Hi, my name is Mike. I'm the level 1 student today. Can you give me a report on your patient?
Sure. I'm taking care of Greg Lutz. He's a 67-year-old male. He's in room 621. He's here. He was seen in the doctor's office. He complained of elevated blood sugars for 5 days. He has a right wound on his heel, or a wound on his right heel. So when he was brought in, he was found to have stage 2 diabetic ulcer, and he also has type 1 diabetes with a history of it for 20 years. He has tingling in his bilateral extremities for the last 3 months. His pupils are equal, reactive to light. His ocular movements are intact. His skin is moist besides, the skin is intact and moist besides the pressure ulcer, or the diabetic ulcer. He's alert and oriented ×4. He does have a deficit to the pinprick on his bilateral lower extremities due to circulation. He complains of no cough. His lungs are clear. His breath sounds are within reason. His breathing is unlabored. He doesn't complain of any chest pains, no abnormal heart sounds. His pulse is regular. His heart rhythm is normal. He has bowel sounds in all 4 quadrants. His appetite is fine. He is on an 1800 diabetic diet with 2 grams sodium restricted, and that's about it. He had some labs drawn. His albumin was 4.2, which is okay. His hemoglobin A1C was 6.2. He did have, his last blood sugar was 242 at 8:30, so we are going to go ahead and give him some insulin.
Okay, so why specifically is this client receiving this medication?
Because he is a type 1 diabetic, so his body does not produce insulin on its own.
Okay, what action does the medication have on the body?
It stimulates the glucose uptake in skeletal muscle and fat. He takes regular insulin and also NPH insulin. They're paired together because the regular insulin is fast acting and the NPH insulin is long lasting.
Okay, and when should you question administering this medication?
If the patient's blood sugar is low, because of risk of hypoglycemia, or if the order...
Does the medication have a therapeutic serum level?
No, it does not.
What vital signs must be monitored?
All vital signs must be monitored. However, the blood glucose is the most important.
Which physiological parameters should be monitored when the medication is being administered?
Any signs of infection or swelling around the administration site, any sweating, or any evidence of hypoglycemia.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
They need to know the signs of hypoglycemia. They need to know the correct way to administer the medication, and they need to understand the importance of keeping the area sterile and clean.
What interventions must be taught for taking the medication safely at home?
Making sure that they are washing their hands using alcohol swabs to clean the area beforehand, and changing the administration sites.
What are the side effects and potential adverse reactions?
The side effects sometimes are cough, nausea, vomiting, and any adverse effects would be hypoglycemia.
How will you know the medication is effective?
When you check the next blood sugar.
Okay, thank you.
Okay. Knock knock. Hi, Greg. My name is Tony. I'm going to be your nurse today. We checked your blood sugar level, and your blood sugar was 242. So we're going to go ahead and administer some insulin. Pause it. Okay. Knock knock. Hi, my name is Tony. I'm going to be your nurse today. Can you go ahead and tell me your name and date of birth?
Greg Lutz, 5/19/1960.
going to be giving you some insulin because when we checked your blood sugar last, it was 242. So I'm going to go ahead and check your wristband. Okay, so I'm gonna go get the medication. And then I'm gonna verify your ID band with the MAR. Okay, good. So when I'm going to get the medication, I'm going to make sure I have the right time, the right patient, the right dose, the right route, and the right medication. So I'm going to check the labels with the MAR, and I'm going to make sure I have the right medication and the right dosage. Then after I make sure I have that checked, I'm going to check that I have the right insulin, the right medication, and that it's not expired. So then I'm going to open my needle. I'm going to go ahead and clean the tops of medications. And there is 16 units of regular insulin and 20 units of NPH. So I'm going to draw up 36 units. I'm going to inject 20 units of air into the NPH insulin. And then I'm going to inject 16 units into the regular insulin. Then I'm going to draw up 16 units. And then draw up 20 units of the NPH insulin. Okay, so once I have that, I'm going to go back into my patient's room. I'm going to again check the right medication, the right order. I'm going to verify it again that I have the right patient. And do you have any drug allergies?
No.
Okay. And it says on the MAR you do not have any drug allergies. And then again, just that I have the right time. I verified the right patient, the right dose, the right route, which is going to be subcutaneous, and the right medications. Okay, so we're going to be giving you your insulin into the subcutaneous tissue in your abdomen. Where did you last have the injection?
On the left side.
Okay, where do you prefer, do you have any preference?
You can do it on the right side today.
Okay, so we'll go ahead and do it on the right side. I'm gonna wash my hands. Put on some gloves. And then I'm going to go ahead and administer. Before I do, just make sure that again, I have no drug allergies, that I have the right patient, and it's the right medications. And I'll go ahead and administer. After I clean it with an alcohol swab. questions for me. I do know that, you have the ulcer that's on your right foot, and you had some questions about it. So we're gonna give you some information on that. So I'll go ahead and talk to you about it now, and then you can take this home with you. Some important things you're gonna wanna know, you're gonna wanna make sure you're wearing your shoes at all times. Wash your feet with warm water. Moisturize, you can use moisturizing lotion. And make sure that the areas between your toes are completely dry, and that you make sure your shoes fit properly and they have enough cushioning. I'll give that to you. Do you have any other questions for me? Okay. So then when I'm done, I'm gonna go ahead and document that I gave the medications. So now that I have documented my medications, do you have any questions for me?
I do. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, it's important to look at the blood sugar, because if the blood sugar is too low, you do not want to give the insulin.
Okay, and did this information affect your decision to administer the medication?
Yes, because the blood sugar was high, I was able to give the insulin because of the order, and
Did this information affect how you administered the medication?
no, it didn't have any effect. It was just the blood sugar was high enough, so we did give the medication.
All right, thank you very much.